If I had to pick one thing that I would do in my retirement, I'd say I love to fish. Fishing is the ultimate proof of the adage, luck is where opportunity meets preparation. Now, no matter what kind of fishing you do, there's little better than the feel you get when you see the floater sink or you see the swirl around your bait. You're ready, you set the hook, you reel in the catching. There's a little worse than when you miss your chance because you're talking or reaching for another drink. Now today, I want to tell you how many dentists are missing their opportunity with this big marketing mistake. Stay tuned. Hey, Colin here, and today I want to talk about a common mistake dentists make, and that is not preparing prospects to accept treatment and not being ready when patients are ready to pull the trigger. Now first, you have to realize that most patients aren't necessarily ready to accept your treatment the first time you present it to them. And this is especially true the higher the price tag. The higher the price, the more trust that's required before they're going to say yes. You have to realize that just telling someone they need an all-on-4 or even a single implant can be overwhelming. And that's before you tell them the cost. You have to educate your prospects about the importance of what you're recommending. But too few doctors wait until the patient is in their chair and then drop the bomb that it's going to be 25 grand. And then they just expect them to say yes. So what do dentists have to do to get patients to accept major procedures? Well, it takes a little bit of luck if you think of luck as being preparation plus opportunity. Preparation means you've prepared that prospect with the information they need to see the value in your treatment plan. Now, I'm going to talk about this more in the future. Today, I want to focus on the opportunity portion. Opportunity means that two things happen in your patient's life. First, they have some kind of dental problem that causes them pain. This means that their gums hurt because of their dentures, or they can't eat the foods they love, or they're embarrassed about their smile. It can be physical, it can be emotional, it can be psychological pain. Secondly, they have some kind of life-changing epiphany. Someone close to them does. They have a major illness, a child gets married, or maybe, God forbid, they're getting divorced and getting back into the dating pool. Suddenly, their smile and their teeth, they're important to them again, and it's not for dental reasons. These are the things that make people ready to make a major financial investment in their dental care. But are you prepared when they're ready to accept treatment? Do you have the internal and the external systems in place to follow the old advertising adage of the right message to the right audience at the right time? Most dentists don't have that set up. They haven't created that. And this is unlucky in the worst kind of way. That's the fisherman sleeping on the bank with the fishes biting on his bait. If you want to see what these systems look like that we created for Dr. Raleigh Pioch, that took him from $800,000 to $3.2 million in just 6 years in one of the most fiercely competitive markets in the country, go to piochcasestudy.com and get a free download of our case study. Pioch is spelled P-I-O-C-H. Now, I'm going to take a little break from our series for the next 3 days, but I hope you'll come back Saturday. I want to talk about keeping track of all of your dental prospects and touching them constantly. Until then, keep moving forward.